I'll make you host again. How do I do that? I can't see any participants. Having problems. Nisha is. Nisha, I made you the host again. Are you okay? Yeah, are you host? Your microphone is muted.
Yeah, I got it.
Yeah, all right, okay. Now I hope everything is live streamed. Hi, Harren.
Good evening, Dr. Nisha, Laura. How are you going?
Hi. It's 8 o'clock now. Should we make a start? Okay. Okay, thank you, everybody. Hello, welcome. Thank you for joining this webinar. My name is Nisha Burton-Jones. We will make a gentle start as everyone comes into the webinar. I acknowledge that I'm hosting this webinar from the lands of the Camaragal people. I also acknowledge the traditional custodians of the various lands on which you all are today. We're presented with an opportunity to learn how experts in Sri Lanka are tackling the healthcare crisis and what your support and contribution will mean to the lives of newborns. Our panel of experts include neonatologists, Dr. Saman Kumara and Dr. Surantha Perera, Dr. Anver Hamdani from the Ministry of Health in Sri Lanka, Dr. Lionel Borpage, convener of the Save a Dream Initiative, and Harren Brown representing Rotary Australia. We will hold a Q&A session at the end of the presentation, so please feel free to submit your questions via the chat box. You can also contact us via the website, saveadream.org.au. Now, without further ado, I'm pleased to introduce our first speaker. Lionel Borpage was a chartered professional engineer with a long career in the public and private sectors. He wears many hats as a social activist and is a very passionate person about issues affecting communities in Sri Lanka and Australia. Thank you, Lionel.
Thank you, Nisha. Aibowan, Wanakkam, Assalamu alaikum, greetings to all. Our webinar is being held from the lands of the Wiradjuri people of the Kulin Nation here in Victoria, and I wish to acknowledge them as traditional owners. I would also like to pay my respects to their elders past and present. We are here today because we care. We care about the people of Sri Lanka. We wish to help in whatever small way we can, regardless of our many differences, and to work together as an inclusive and united community. In the wake of several disastrous and unprecedented situations in the past, both in Sri Lanka and in Victoria, we have come together as a team and worked as a collective. We have seen the positive outcomes of several such collaborative efforts. For example, in 2017, when Sri Lanka faced the second worst natural disaster in its history, 7 organizations in Victoria got together and helped rebuild the worst damaged school in the south of Sri Lanka. During the Black Summer bushfires in 2019-20, around 20 organizations and individuals collectively held a successful fundraiser to assist the Country Fire Authority of Victoria and the Victoria Zoo. When the COVID-19 pandemic was declared in March 2020, 13 organizations from Victoria and New South Wales and several concerned individuals came together to form the Sri Lanka COVID Aid Collective and provided the affected Victorians of Sri Lankan origin, Sri Lankan international students, and others of Sri Lankan origin with material aid, financial, legal, and mental health support, and advocacy and employment advice. In May 2021, when the COVID pandemic was devastating Sri Lanka, the Sri Lanka COVID Aid Collective responded to direct and indirect requests that came from diverse sources in the island. We distributed such assistance via Sarvodaya, Red Cross, and the Rotary Club of Colombo to ensure probity. Also, we collaborated with the Rotarians in New South Wales and Colombo to deliver much needed medical equipment to three major hospitals in Sri Lanka. We believe our assistance to Sri Lanka contributed to saving many lives, improving healthcare responses, and keeping the health system in a state of preparedness. The exemplary collective efforts by Sinhala, Tamil, Muslim, and Burgher expatriates had been a positive sign for the future. We were able to rise above our differences to help those in need. Now, the people of Sri Lanka are battling the worst economic crisis since its independence. The lack of foreign exchange to procure vital imports has triggered weeks of anti-government protests. The consequences of this crisis are highly apparent and have adversely affected the healthcare sector. Hospitals and pharmacies across the country have almost run out of essential medical supplies. Many vital drugs, including anesthetics, are said to be in short supply. The right to receive proper healthcare is a basic need. It is a fundamental right, regardless of one's religion, creed, or class. Many healthcare workers have been asking for drugs and medical equipment, including endotracheal tubes to help babies breathe. The very first such public appeal came from Dr. LPC Saman Kumara, one of our panelists here today. There were some confusing communications later on. However, subsequently, the Sri Lankan medical fraternity made several requests for assistance. It was stated that certain medical equipment is being washed and reused instead of being discarded. This poses the heavy risk of disease transmission. Any family would want to save their loved ones, no matter what the situation is. No parent wants a child to die in their arms simply because they cannot find the medication or equipment needed to keep them breathing. Any healthcare professional facing such a situation will feel helpless, and we all are heartbroken about such a situation in the land we were born. A mother carries a child for 9 months in her body, 3 months in her arms, and then in her heart for all eternity. Every parent has a dream. They want their children to grow to be happy and healthy. That is why we named our team Save a Dream, to save the dream of parents by saving the lives of neonatal patients of our newborns. Let us unite as a community and save the dream of many parents in Sri Lanka as possible, who have become so distraught in the current circumstances. Let us do our very best in making this endeavor a complete success. Together, we can make a positive difference. Thank you very much for your attention.
Thank you, Lionel. Our next speaker is Dr. Kumara. Dr. Kumara is the first qualified neonatologist in Sri Lanka and has been a consultant at Castle Street Hospital for Women for the past 12 years. Dr. Kumara is also the president of the prestigious Perinatal Society of Sri Lanka. He has introduced many novel therapies, resulting in groundbreaking changes in neonatal care and patient outcomes. Over to you, Dr. Kumara.
Hi, thank you very much for inviting me. Hope you can hear me.
We can.
Okay, thank you. And first of all, I'm really grateful to all of you, the team of Save a Dream, for inviting me and organizing this webinar to help our motherland. We are actually in a really difficult situation. And can I share my screen? Do you see my screen?
We can see your folder, Windows Explorer folder.
Do you see my screen?
We can see your screen, but not the slide presentation. It's the folder.
Okay, just a minute.
Yeah.
You're still not seeing my screen, right?
No, not the slide set.
No, I think Dr. Saman Kumara, if you when you press share screen, you may have to select the particular application or point or whatever in the file. What we see is the file explorer vision. If you go to the screen and select the PowerPoint presentation itself.
Yeah, actually I've selected it.
That's right now.
Is it coming?
Yes.
Right, super. Okay. So, right, okay.
Dr. Kumara, did you want to select the bottom right slide presentation icon? Bottom right, next to the percent value, right at the bottom of the screen.
Yes.
Yeah.
Is it on now? You okay now? Can you see it now?
Not yet, but you can, that's fine. You can probably go ahead. That's fine.
Do you see the screen? Do you see my slides?
We can see your slides, yep.
Okay. So just a little brief introduction about who I am and my contribution to the country. Yes, as you said, I'm the first neonatologist in Sri Lanka, and I qualified in 2020 and came back from UK after my overseas training. And I have been contributing to the neonatal care for the last 12 years and done so much of things for the country for the first. My present role in this crisis is, I think, what is most important, and how I got involved with this donation programs. Actually, that is something which happened accidentally. About three weeks back, my hospital staff, the people who are dealing with the stores and the pharmacy, they came to me and said, Dr. Saman Kumara, we are going to run out for endotracheal tubes. As you all know, endotracheal tube is a little plastic tube which goes through the mouth, through the throat, to the lungs when anyone is in trouble for breathing. So they were referring to endotracheal tubes for babies. As I'm dealing with newborn babies, not having endotracheal tube is a nightmare. We have ventilators, we have all the other facilities to give artificial breathing when a baby is in trouble. But missing a little tube to connect the baby and the machine is a disaster, because you can't do anything without that little piece of plastic tube, which we call endotracheal tube. And it was out of stocks, and it was not available in the Ministry of Health, where what we call medical supplies division. And actually, I started sweating when I heard it, because I knew that we were having some kind of trouble because of the current situation in the political and economical situation in the country. But I never thought that I would face problems with things like endotracheal tube, which is really a nightmare. Then I started spreading the message, because I have the network of all the neonatologists and the pediatricians who are looking after newborn babies all over the country. As the president of the Perinatal Society, I'm in touch with all the consultants all over the country. So I just immediately sent a message not to waste it, because sometimes because of we not being careful, sometimes we occasionally we waste it, and not to waste, and also start not to discard the used endotracheal tube, because it is not at all acceptable to use an endotracheal tube which is used. To reuse it, not acceptable. And but my plan was, sometimes we remove the tube from one baby and we pass a new tube. And when we do that, my message was to keep those tubes which are removed from the same patient and wash it and keep it stored somewhere with that baby to sterilize it and use it for the same baby. That is something better than not using it for another baby. But worst come to worst, I said, okay, if you have no other option, then we may have to sterilize it and use it on other baby. I mean, these things are not acceptable at all and highly substandard, but we went up to that situation. And then I have a batchmates group, WhatsApp group with my batchmates, and a lot of them are in other countries, and some of them are consultants, and we regularly communicate through this WhatsApp group for other reasons. I just sent, actually I was so busy and I did not have time to type the message. I just recorded a voice message to my friends, my batchmates. It was only for that group, for my batchmates, and if you really carefully listen to that voice message, I even don't mention my name in that, because it's sent to my friends. And I just requested for them to help me to send some endotracheal tubes. I was basically concentrating on Francis Street Hospital. But somehow or the other, that voice clip was taken by my friends, or maybe one or two friends, and my name and the designation, the hospital name, and my mobile number was attached to it. And then they started sharing it, and that went viral. That went viral, and that went all over the world. And you won't believe, I could not sleep about 3-4 days when that happened. I started getting calls from all over the world, especially Sri Lankans living outside Sri Lanka, and not only Sri Lanka, lots of non-Sri Lankan well-wishers. They kept calling me, and you won't believe, I was so tired answering calls, and I had a very difficult 3-4 days. Could not sleep even, but I really enjoyed, because it was I could not imagine that much of response from people outside Sri Lanka. Not only there were calls from Sri Lanka, as well as a lot of calls from outside Sri Lankans as well as non-Sri Lankans. And so then I'm sure some people were a little angry with me for not answering the calls, because when I looked at, I counted actually, on those days, I had answered 500 calls, and there were another 500 calls which I could not answer. They were like missed calls. And there were thousands and thousands of WhatsApp messages. And I had no way of communicating or answering all this. But throughout the night, I managed to answer as much as I could and respond to the WhatsApp messages. Then what I did was, I have two secretaries. I got them into one room, and I gave my phone to them and asked them to make WhatsApp groups. And I made 3 WhatsApp groups. Each group has about 250 participants. So then it was easy for me to communicate through the groups. So that's how and with that, this message was sent to the whole world. And then I have to say this actually. I'm sorry, I have to say this. The Ministry of Health probably was not very happy with this, whatever which happened with this message, because they were probably feeling a little uncomfortable to, for other people to know that we are in trouble, we are in crisis with not having some most important consumables in our country. So I had some problems with that because I did not have any personal issues and nobody questioned me, but they started, publishing some documents or making news items saying that there's no such problem in Sri Lanka. There's no such problem, and the medical equipments and the drugs we have enough stocks, and there's no problem. Then I actually started facing problems with all the other people who have got connected with me. Then actually, because I kind of became a liar. Then I contacted the Director General of Health Services, Dr. He's a very humble person. I know him, and I said, please correct that, because otherwise I will be a liar for the whole world, and this is not the right thing. That the following day, I think that was corrected, and then everybody started writing letters, asking for help, asking for donations, and even at the Ministry of Health, they have a separate system to get donations from all over the world. So it's something very obvious now. So this is how all this process started. I'm happy that I became the initiation for that. So I'm actually happy that whatever happened now, people have started helping. So the present situation, the crisis in the health sector, we are with this message. Actually, it was only meant for endotracheal tubes. So I started getting a lot of endotracheal tubes from all over the world, and people started sending from personally sending to people who are coming to Sri Lanka as hand baggages, and I ended up having a lot of endotracheal tubes, and I'm storing it at Castle Street Hospital, and also I'm distributing to the whole country. So everybody is in touch with me. So we don't right now we are getting enough endotracheal tubes, and if I get all the promised supply of endotracheal tubes, we will have it enough for this year. So the endotracheal problem is actually is not a problem right now, but we are facing a lot of problems with other consumables. There are so much of there's a heavy list of drugs which are life-saving drugs which are lacking, and also some consumables like I don't know whether I'm sure people in medical field can understand. There's something called blood gas machine where you check the blood samples of a baby or any patient who is being managed in ICUs. We do the blood. There's a special test called blood gas, and this blood gas machine needs. There are some consumables for this blood gas machines, and there's something called cartridge. And these cartridges we are running out of these cartridges, and we have a couple of our cartridges which is enough for another next month, I think. But after that, we are not going to have blood gas machine consumables. And without blood gas machine, you can't think of managing a patient in ICU, baby in ICU, adult patient in ICU, child in an ICU. You can't manage because you need to have blood gas testing done maybe a couple of times a day. So this is one good example, because I contacted the company and they can't import it because of the dollar issue. And this is only one example. And there are a lot of antibiotics and life-saving other medications and consumables are still lacking. I think the reaction from the Ministry of Health was disproportionate, as I said. But I think now the Ministry of Health is more kind of streamlining all these things. And Dr. Hamdani is, I'm sure he has already joined. He will explain what is happening at the ministry level. So they are having more organized way of getting these donations. And so present situation with donations is now medications wise, it is, I think I have a separate slide for that. We are getting some consumables like endotracheal tubes through various pathways, especially like by post and by through people who are coming to Sri Lanka. But people like you all living outside Sri Lanka, buying a medication is not very easy. And also it is not a small quantity now, we need large quantities. So therefore, organizing at your level, I think we have to discuss what we can do for that. So this is what I want to say. The Save a Dream, how you can help. Donating items directly, if you can buy them, that is okay, like what you have done for endotracheal tubes. There are other items which we have shared with a lot of well-wishers, and whatever you can buy over the counter with our specifications, that is perfectly all right to buy and send through whoever who is coming to Sri Lanka, or by post. But only issue is, if you are sending it by post, the clearance will be a problem. But small quantities, small parcels, the custom, Sri Lanka custom is aware about this, and which is coming through the Ministry of Health or under my name or Director of Castle Street Hospital, so far we have not had any problem. They release it, but large quantities will have problems in terms of clearance, and also
thank you, Dr. Kumara. For those of you that couldn't.
Hello, can you hear me? Hello.
I think Nisha got stuck. I don't know. Yeah, Dr. Kumara, if you wish to, you can continue. I think Nisha's microphone didn't.
Yeah, I think, yeah, something happened. Yeah. So, and also if you are sending medications, the big problem, the main problem is NMRA approval. As you all know, if you are sending a medication, if you are sending a drug, it should be approved by, especially by the Ministry of Health or NMRA. So, say for example, if we need some particular drug, like say for example antibiotic, although it is a proper antibiotic, if it is not registered under NMRA, then we can't use it. So we need NMRA registration, and so those are the issues when you buy individually things from overseas. The next thing is what the people like you can help. We order the things, but you can pay the mother company directly. We have the local agent. So I'm referring to the same product. Say for example, if you are lacking antibiotics, so same antibiotic, same product, the same local company, but because we can't buy it because we don't have dollars right now, but we can make the order, and the payment can be done by overseas well-wishers directly to the mother company, and the local agent can handle it, the rest of it, and importing it and clearing it and handing it over to the Ministry of Health. So it is something hassle-free. The next option is, I think this is, I know this is the last, and probably most of the people don't like this. There are so many charities in Sri Lanka. The one charity is Save a Baby charity, which I'm directly dealing with through the Perinatal Society. But likewise, there are other charities by various professional organizations, and they have dollar accounts, and people have started donating to those accounts, and the particular charity can pay whatever the mother company through the local agent to handle. I know this is, people don't like to send dollars to Sri Lanka because of obvious reasons. I understand it. So these are the options. But before I forget, I'm actually right now facing a major issue at Castle Street Hospital. I have to say that there's one particular medication which we call nitric oxide, which is a treatment for extremely sick babies. It's a life-saving medication. It's a gas. It comes in a cylinder, and we started using it only for about last 2 years or 2 to 3 years. It was not available for up to that point, but this is a life-saving. Because of not having this particular treatment method, we lost many babies. They are salvageable, very good babies. We lost because of not having this particular treatment. But we are lucky we started getting this treatment. We introduced this treatment about 3 years back, and we have been having this and using this, and we have been saving many lives. But I'm in a problem because this nitric oxide is going to be out of stocks. And this is extremely expensive. And one cylinder, one 10-liter cylinder is going to cost about 500,000 Sri Lankan rupees. And this is coming from developed countries. This is either coming from UK or Australia or New Zealand. And right now we were getting it from Australia actually. So this is, I don't know how, this is something that, that's something that we need to focus as an urgent issue to save life. And I'm using the last cylinder at Castle Street Hospital, and it is the same situation all over the country. And very soon we are going to run out of it. And after that, we are going to lose many, many babies. And these are babies who normally, sometimes some babies, they aspirate meconium, their own poo inside mother's tummy. And they are the babies who are getting into trouble. So I just, before I forget, I just want to say that. Finally, I have to say, what an amazing children of Mother Sri Lanka, and also a lot of non-Sri Lankan well-wishers. Unbelievable response, unbelievable response. And you won't believe how many times I cried over the last 3-4 weeks, because people called me, and how many people cried during the conversation. So they are so sensitive, and I have no words to explain it actually. So thank you very much. You are donating. This is how I look at your donations, and this what I have been telling all the donors for last decade. I have been getting a lot of donations to develop my ward. You are not donating goods. In my vocabulary, you are donating lives. So I do not want to say thank you, and I have to say good afternoon. Good afternoon. Puji Saranai. God bless you. Thank you very much.
Thank you, Dr. Kumara. Our next speaker is Dr. Surantha Perera, but I think he might be just running a little bit late. So we might move on to our speaker that is from the Ministry of Health, Dr. Hamdani. Dr. Hamdani was recently appointed by the Sri Lankan Health Ministry to coordinate efforts to keep healthcare services running and to overcome shortages in medical supplies. Dr. Hamdani, over to you.
Give me a second. I think Dr. Saman Kumara, if you could remove share screen from you. Yeah, thank you.
Okay.
How do you do that? Are you all right?
We can
Yeah,
hear
I do
you.
not have anything on slide basis to share, but I'm going to be speaking to you all on what is the process running through. I think Dr. Saman would have explained to you and he has elucidated, which I rather understood, that how well this crisis was, taken up by a single individual, and how well he could, walk through forward along with us. And all what he told was the truth, but bold truth. So what we believe here at this juncture is true and well that we should understand that we are facing a challenging period actually, which is rather daunting to all the categories of healthcare workers within the country, because they've been been exhausted for about 2 years of a period where they've been working day, night, and noon for the COVID, and all of a sudden this flashes in, and day-to-day events, day-to-day lifestyles have changed in the local setup here. So it is really daunting for each and every individual. And on top of it, when you see that where the essential medications are running short, or essential medications rather being, running on limited stocks or being released on, staggered basis. So that is rather an alarming point where people have to decide for alternatives, people have to decide for what they should be doing. So that is how Dr. Saman Kumara approached the rest of the world, and the call was very well answered with God's help. True and well. Now, as of now, there is a list which we have compiled. I think this is one of the clear messages. I think the Director General of Health Services and the Secretary of Health Services wanted me to be presenting to each and every organizations. The Ministry of Health has compiled a clear list, which are, vital, essential, and the normals. So, which we have it on a daily basis updated onto our platforms, and which is being shared along with all the respective donor communities. So whenever you come across something, please, I think Dr. Saman knows this process. Whenever he gets somebody into donating something, he always get in touch with me, so he knows that the process runs through and the donor will not get affected, and as well as the goods will be delivered to the proper place as well. So this is one of the mechanisms that you should be following. So I will text you the email address, which is easy for you guys to see it across and know what it is. And that's number one. Number two, where it stands is, whenever you have a question over things, you can always email it to us to find out what is happening. So the basic program runs is, okay, you email across, you find out a shortlisted list. So you can choose your organization, individual, rather a community can choose, okay, we're going to pledge this. So after choosing, they can write back to us telling that, okay, we are pledged it. So if they are willing to pay the supplier directly, if the supplier is in Sri Lanka, local supplier has it extra, or the suppliers in India, suppliers in Bangladesh, or in any other countries, if the donor is willing to directly pay the supplier and send us the good, that is the most mechanism. We are welcoming that. And if it is available locally, we liaise the donor with the local supplier, where the local supplier can be connected and they can liaise with the local supplier and negotiate and tell that, okay, the product will be delivered. And along with that, donor can have a demanding factor that a donor is requesting that my donation should reach the General Hospital Hamatur, General Hospital Vaunia, or the Lady Ridgeway Hospital, the Castle Street Hospital. So we always accommodate that, provided that that particular supply is not inundated in those hospitals which the donor is referring up to. So donor can make that choice as well. Then what happens is, then we will, if it is going to be an import, to Sri Lanka, so then we advise them, okay, the consignee should be the Secretary Health and it should be addressed in this way. We give all the details in that particular email address with a flowchart. And you need these are the documents you need. If the product is not approved here in Sri Lanka National Medicinal Regulatory Authority, so we help them. We actually rather facilitate to get that temporary. You call it the waiver of registration. The temporary registration has been given and the product is accepted to the country for the utilization of the public. So these processes can be streamlined, smoothly made through. The donors can be, made, kind of make their life very easy, rather, because they're coming all out of the way to help when we are in need. So it's our duty to, flex all the red tapes and get, the best to the people and serve the people best. And this is what we are thinking ourselves now. And in the meantime, the Ministry of Health is most likely in a couple of days' time, the Ministry of Health is officially granted to have a $8 currency account where the well-wishers and the donors can always, flush in their cash into that Ministry of Health dollar currency account. Along with that, as of now, 4 colleges have got together and under the name of College of Physicians, they have started a college, foreign currency account as well. So within this, where the certain credit lines which had got stuck due to the Forex crisis will be looked upon, and we can actually transfer this, funds which are coming to this Ministry of Health, account, or rather to any other account which is legible and accepted, which can be transferred to the LC needed account within that same currency. So there won't be any of issue, because otherwise, unlike the other other events, like if you'll have to convert it into a dollar currency and then transfer, that takes, half of your hard-earned money gone into in between transactions. So this will not happen because it's a dollar currency account itself. So these are the few mechanisms which the Ministry of Health has taken up, and Ministry of Health is closely liaising and working with all the colleges, as Dr. Saman Kumara said. So we've been working with them, getting suggestions, getting the shortlisted drugs. So it's always, if the shortlisted drugs have been, or shortlisted consumables have been notified to us earlier, and if that can be, taken up, so it should be addressed. So we will obviously take measures to address it. And we've discussed a few things with the World Bank, the Asian Development Bank, and the WHO. And on few diplomatic consignments are also yet to be arriving in the country in coming days, in a couple of days rather. Tomorrow and day after, there are 2 diplomatic consignments coming through. So we hope and pray that with all your support and all the blessings with the expatriate Sri Lankan community, which I should specifically mention, a community which had, spread a lot, is the Sahana Foundation in the United Arab Emirates. That had been a community where day in and out, and they've been sending something daily. That might not be. It's kind of what we don't have is kind of ocean. That might be a small drop of water, but still that mattered. So many people in this country. That has saved a lot of people in this country. So I give all due respect to them. And in each and every webinar, I used to, make a note of them, because that had been a great community. Even today, there was like this, the catheters. I think Dr. Saman Kumara would understand better. The catheters were running out of stock before about 2-3 days back. So all of a sudden we reached up to them. The next day it was landed, 1,200 catheters. So that is how it worked with all this, fellow Sri Lankans and non-Sri Lankans and all philanthropists around the world, like you all. So I make this opportunity to thank every one of you for contributing, and who is willing to contribute and who's hoping to contribute. Let's fight this, and we will come over it. Thank you so much.
Thank you, Dr. Hamdani. Please stay online for the Q&A session. I'm sure you'll receive lots of questions from the attendees through the Q&A and chat functions. Our next speaker is Harren Brown. Harren has been a long-standing Rotarian with multiple roles within the club. Harren is the Rotary District Foundation Grants Subcommittee Chair. Thank you, Harren.
Thank you, Nisha. I'm not going to speak about medical, but I'm just going to give an overview on Rotary and the programs that the Rotarians have done in Sri Lanka, and then how we can help, how our partnership with Save a Dream team. So just a brief introduction to Rotary, as most of us would not be aware of. Rotary is the oldest service organization with over 1.4 million volunteers who contribute about 47 million volunteer hours supporting communities. In 2020-21, the Rotary Foundation spent $333 million in sustainable humanitarian projects across the world. Rotary and Rotarians are not first responders. As such, we continue to support the communities through our various programs. For example, my club, the Rotary Club of the Hills, Callaway, and the other clubs in my district have been supporting sustainable humanitarian projects in Sri Lanka since 2012-13. We join hands with community to support the Teaching Hospital Jaffna, Days District Hospitals in Ariampadi, Chowiteri, Diatalawa, Kegol, and Kilnochi, as well as Ragama. The projects varied from the establishment of the eye unit, enabling orthopedic surgery to give dignity, as well as give dignity to the deceased through mortuary facilities. The recent project that was completed to set up a 5-bed dialysis center at the Kilnochi District Hospital. These projects focused on disease prevention and treatment, which we are discussing today. As well as particularly to the mental and child health, we have funded the surgery for children with congenital heart diseases across Sri Lanka, which should be taking place at the Lady Ridgeway Hospital, and as well as providing clean water and sanitation to the estate communities. So the Rotary Club of the Hills, Callaway, through their program, Sustainable Community Development Programs, India, Sri Lanka, joined with Save a Dream team to empower the medical professionals and the environment in Sri Lanka to save lives. So your generous donations will help us save lives and save dreams, because there should not be a single parent who has to lose a child through a preventable cause. So thank you, Nisha, and thank you to the team.
Thanks, Harren. We were meant to have another speaker on today, Dr. Surantha Perera, but I can't see that he has joined. So we will perhaps go to the Q&A session now, beginning with some of the questions that were brought to us through the chat and QA functions. So can we have all the panelists showing? Gallery view. Did Dr. where's Dr. Hamdani? Is he? It looks like he may have left. Alrighty, so some of the people have asked whether donations are received through saveadream.org.au, and yes, you can definitely donate through the website. So please go to the website to make any donations. There's a question that says that most expatriates prefer to deal with the approved suppliers rather than the ministry. I guess that question was to Dr. Hamdani, who's left the meeting. There's another question that says, what we need to clarify, does this list include all the hospitals around Sri Lanka? How often is the list updated with the donor support? Who are the providers in Sri Lanka? And how does the GMO support donors in relation to consignments? Perhaps Dr. Kumara could respond to that. So there were a couple of requests that came through, certainly to Australia through the Perinatal Society and Ministry of Health. Dr. Kumara, are you able to tell us why there were two different letters? Does the Ministry of Health letter also include the neonatal requirements for Sri Lanka?
Sorry, I didn't get your question very clearly because there's some connection problem. Can you repeat the question?
Sure. There were two requests from Sri Lanka. There was the one from Ministry of Health, and there was the one from the Perinatal Society of Sri Lanka that listed the neonatal requirements. Can you please advise why there were two different requirements and lists sent to various countries, and how are the donations coming through? Have there been any donations that have been sent from around the world so far?
Well, actually, I have to say the requirements have not been, I think now the Ministry of Health, they have kind of organized a more comprehensive list of requirements because it was a kind of a chaos at the beginning, because people started requesting at individual levels, individual consultants, they started requesting their whatever they wanted, and the lists were all over the place. But now the Ministry of Health, they are kind of in the process of, I think they have already made a fairly comprehensive list of items, although which is not fully completed. Now, for example, things like nitric oxide have not been included because I think there are some gaps in this list. Anything else you want to ask?
I guess everybody just wants to find out how are the supplies being cleared through Customs and Ministry of Health, and yes, how do we ensure that the product will actually reach the hospitals and there's assurance that there's no profiteering from what's received?
Yeah, what is happening right now is if people are sending large consignments, that should be definitely sent to the Ministry of Health, because the clearance and the clearing and the paying taxes and the waiving of tax and all that, we can't do it. Now, say for example, if someone sends me a large consignment under my name, then the custom will not definitely give any, it will not be released without taxation and all the other. There are a lot of red tapes. In other words, there are a lot of red tapes if something is sent to an individual address, individual way. If someone is sending something, there are a lot of red tapes, and to clear that is a big hassle. But all the large consignments can be sent to Ministry of Health. I know. I have to say that because I have been in touch with majority of all the well-wishers, Sri Lankans, non-Sri Lankans, but to be honest, they did not even want to send a single ET tube to Ministry of Health. So that was the situation. So people don't like to send things to Ministry of Health because they are not happy with that. But I think there's no other way. When it comes to large consignment, it has to be sent to Ministry of Health so that the ministry clears it, and they have the ways of clearing or waiving of taxes, and they don't have to pay taxes, and they officially can clear it from the customs and take it to the Ministry of Health and distribute to the rest of the country. But small consignment, which are, as I said, can be sent through individual basis. But Sri Lankan custom is also aware about this issue, and they don't make big, they don't create a lot of problems when these are medical items with a letter. What I do is, if someone is coming, bringing something, I WhatsApp a letter under my letterhead in Perinatal Society of Sri Lanka with my signature. They carry it and they show it to the custom officer, and they know it. This is brought to Sri Lanka at the request of some organization, and then they release it. So I'm always happy to give a letter for anybody who is bringing something to Sri Lanka. And only thing, we have to be very careful. People can misuse this, and illegal things can come to into the country. People always can misuse this, so we have to be a little careful. And I have told the custom, if something is brought to the country with my letter, with my name, and to check it 100%. Check it 100% and release it. Otherwise, I can be in trouble.
Thank you, Dr. Kumara. There are a few more questions, if you don't mind me asking or directing them to you. Thank you so much. There's a question from Irosha Premaratne. She says, I would like to ask a question about requests sent by individual hospitals. Let me just allow her to speak, if that works.
Hello.
Can you hear us, Irosha?
Yes. Can you hear me?
Yes, we can.
Yeah. So I'll just introduce myself. I'm an endocrinologist in Melbourne, and we have a established medical charity called Oslamat. Most of people in Melbourne will know. It's the Sri Lanka Medical Aid Team, which has been sending equipment to Sri Lanka for since the tsunami, actually. So I just want to I think Dr. Saman, Kumara, you sent me a letter requesting certain things that we can source from here. So yeah. I just want to actually add a couple of points to what you said. So like during the COVID crisis, we send a lot of equipment from here. And if we pre-apply for the NMRA approval, it can be very easily sent to the MSD via actually just overnight on a returning Sri Lanka Airways flight. So it gets there very quickly. And once the MOH or the MSD clears it, it can be directed to a particular hospital. So we can, Dr. Saman, we can still have you as the recipient of the equipment. And once it's cleared, it will come directly to your hospital inventory.
Okay.
So that's quite possible. So with the equipment, obviously we can, as I asked you, there are, especially the Fisher and Paykel equipment, which we can, because it's a Australian New Zealand company, all the Fisher and Paykel equipment we can send from here. And in fact, I've got a agreement with them that give us to the hospital cost price, which is quite a lot substantially reduced cost. But drugs we can't send from Australia. So that's when we have to use the local path that the MOH had created, because we can't just purchase drugs from here, from the manufacturers or wholesalers. We have to, you need like a special approval for that. And only if you like, say, for example, if somebody here owns a pharmacy, maybe they can purchase from wholesalers, but it's not possible. So the other question, was that that I asked you is that, for example, like LRH has a list of items that you requested. Likewise, we have received lists from other hospitals. So actually, this is a question from Dr. Hamdani. For example, if a particular group here would like to purchase this whole lot of everything in the list, can that be organized through the MOH? And can they invoice directly to that particular group?
I think Dr. Hamdani is not here with us now. We have to left, I think. I think I'm sure you can do that. Say, for example, you can select a particular list and buy all the items in that list and direct it, and you can send the consignment to the Ministry of Health, but you can mention, okay, this is coming for this particular hospital. And from this end, say, for example, if someone is sending a list of items to my hospital, and if you mention care of so-and-so Castle Street Hospital, and then I will be notified by the donors, and then I can follow it up. Then I can follow it up and take it to, even if it comes to Ministry of Health, and still I can have a hold of it. And likewise, I just wanted to ask you, Save a Dream organization is working for newborn babies, so I didn't get that part. Is it for babies or is it for complete health care, Save a Dream?
It's to meet the neonatal needs that are currently urgent within Sri Lanka, and certainly there's lots of other areas of the healthcare system that's in crisis right now. But the
name and the theme is 100% going with newborn babies.
That's right. Yeah.
I as the president of the Perinatal Society, I started collecting. Individually I contacted all the consultants and the main hospitals, and I'm almost done with a individual list for each and every hospital. So because it's not easy to organize this list, because people keep asking for various things, but we have to cut down and we have to prioritize, and we have to sometimes people ask for unnecessary things also. So I'm in the process of fine-tuning and the list, but what I'm doing is I'm getting an individual list for each and every hospital, and I'm mainly concentrating on the neonatal care.
Yeah,
so
that's essentially
what the donors can do is I can share this list with the name of the hospital and what are the items which are there and what is the quantity they want. And the individuals the donors can take one hospital, okay, I'm going to sponsor this list. I'm going to take over this list and I'm going to support this hospital. Then if that happens in that way, I think it will be less complicated and each hospital will be looked after by individual donors. So that is one way that you can help. But if you want to really help the neonatal care, as I said, giving nitric oxide. If you can give nitric oxide, because we are going to soon run out of nitric oxide, and that is going to cause many deaths in near few months to come. And if you can arrange purely concentrate on nitric oxide, only nitric oxide through Save a Dream project, and that will save lives. And that is for newborn babies, but that is very expensive, I have to say. We will need about 30 cylinders per month. I'm giving a rough figure, 30 cylinders per month. As for now, Sri Lankan rupees is about 500,000 Sri Lankan rupees. But the dollar, I mean, from the mother company, the price must be the same price as in the past because it is a rupee which has depreciated. So that is one area that you can concentrate. You can think of that and decide. That will save many lives in near few months to come. But when we run out of it, we will have no option for that. And this has to come from overseas, a developed country, and there's no other option. We will see many babies dying right in front of our eyes, and we will be helpless. And this is
Dr. Kumara, thank you for that update. We have a question that says, are there any supplies that you can suggest that do provide nitric oxide?
Yes.
So is it accessible via Sri Lanka, or does it need to be sourced from outside?
This is coming from overseas. This is, I think, there's a local agent registered, NMRA registered local agent, because we have been using this for the last 3 years, and they have been supplying through the Ministry of Health, and the local agent is the Technomedics, and I think they are importing it from Europe or Australia. I'm not very sure, but I just called them while I was in the webinar, and they are going to get back to me with the price and all. But this has to come in a separate container because this is a gas. There are some regulations when it comes to transport, and even if you are sending one cylinder, it has to come in a container. That is the law or the regulation. But they are importing a lot of cylinders, say for example, maybe 50, 100 cylinders in one container. It is cheaper to import many cylinders at one. So there's a local agent, and they are dealing with that.
Right. I think it would be a lot easier for the donors to certainly people like the initiatives like we've got, so Save a Dream, to contact local suppliers and drugs and therapies and devices that are already approved by the NMRA. If you could provide that list to us, we can definitely make that available to our supporters. And I just wanted to also make sure that everybody understood that Rotary Australia is handling the financials, transactions for Save a Dream. So anything that we purchase and all the donations go through to Rotary Australia.
I know it's a huge amount of money, and that's a massive help, and that is going to save many lives.
Thank you. I just wanted to also ask, are you able to please tell us roughly how many patients within the neonatal space that are currently in this situation within Castle Street Hospital, and roughly how many in the country that are lacking essential medicine?
You're referring to nitric oxide, or?
No, just in general. So how many patients are within, the neonatal wards within Castle Street Hospital, and just roughly within the country that are suffering right now?
I can give you a rough figure. Now, for example, Castle Street Hospital, we deliver about 800 to 900 babies every month. That's the monthly delivery rate. And out of this 800 to 900 babies, nearly 30 to 35 babies are admitted to baby ICU, in ICUs for neonatal care. So that's the rough figure. And we have a national delivery rate is about 320,000 deliveries per year, annual delivery rate. And Castle Street Hospital, we deliver about close to about 900 babies every month. And out of these 900, about 35 babies are admitted for baby ICU care, NICU care. But our rate is slightly high because we are a special hospital. We are a tertiary care hospital, and we are basically faced with a lot of complicated mothers, and our ICU admission rate is relatively high because we are a special hospital. But in other ordinary hospital, it is not as much as this, but it's just an idea.
Yeah. Okay, so if we were to ship supplies to Ministry of Health courtesy and addressed to you, for example, are you able to ensure that the supplies are also shipped or distributed across across Sri Lanka to the other hospitals that will be taking care of neonatal patients?
Yes, yes, that is possible. We can follow it up, because as long as if we are notified about a consignment, then we also can have a hold of it, and we can say, look, there's something which has come to Ministry of Health sent by so and so, and what happened that, and where has it gone, and we can make sure that. So that's why I said it is easy if you can do it by hospital wise. Then it comes to the hospital name, although it is coming to the. I mean, Ministry has a absolutely 100% responsibility of clearing this and waiving off the taxes and all that and bringing it to the country. The Ministry has 100% responsibility, and Ministry should do that, and Ministry is doing that, and Ministry has promised me to do that. Because when I had the initial discussion with all the top level Ministry officials, they said, okay, they are doing everything to clear it, and I just need to organize the donation. So if we can do it on hospital basis, hospital by hospital basis, and if it comes to the Ministry of Health, then without even opening the pack, and the whole package or the baggage or the consignment, whatever, and can be sent to the particular hospital, I think that is somewhat easy way to do this.
Right. Okay.
Because when it comes to the Ministry, when they open the boxes, and things will be all over the place, and I'm not sure whether the particular hospital will get whatever they require.
Thank you. I think Dr. Hamdani has connected again, so I will just try to see if I can invite him back in. Hi, Dr. Hamdani, can you hear us?
Hi, yeah, sorry that I have to get interrupted due to an urgent phone call. Very sorry about it.
That's all right.
Thank you very much. Yeah.
Are you able to sort of outline the NMRA requirements and the process to clear the medicine and devices? We've had some difficulty obtaining NMRA approval for some endotracheal tubes that we wanted to send. So just wanting to find out what the process is, what the timelines are to request and receive information so that we can expedite any shipments where needed.
Okay, it's like this. If you get across the supplier details plus the product details to us, we'll check it out whether it's NMRA approved here or not. If it's not approved, you get us the supply details and the product details you all already given us. We'll arrange for a waiver of registration, a temporary waiver of registration. So within that, so you nominate the consignee as the Ministry of Health, the Secretary to the Ministry of Health. And likewise, Dr. Saman Kumara said, if you are interested in specifying any hospital, obviously, of course, yes, it can be entered into the ledgers and transferred into that particular hospital to serve better. I think that is one of the mechanisms we are looking into also. But in the meantime, if that particular, the consumable or drug is scarce within the health system itself, then obviously we'll have to, cater on a basis where it's staggeredly moved out into places also. So it's both the mechanisms are running up at the moment, because otherwise it will be unfair by the donor who is sending with all respect to reach a particular end, because he or she has, been reached by somebody who is suffering from that end. So to respect that, to honor that, we do always, respect the donor's, request. Along with that, we look into the country's need also, because it differs on both ends, because you'll have to understand the practicality of it. True and well, if the 348 hospitals in the country, including the district hospitals and the divisional hospitals, start, approaching each individual donors, and Health Ministry wouldn't be Health Ministry by now, that we'll have to change it to some sort of customs department and do only the clearings. So there should be a national mechanism where the mechanism is transparent and accountable. That is what Dr. Saman Kumar is referring up to. So it will be transparent and accountable, which will be catering the need of each and every hospital or each and every institution which is requesting through.
Thank you. Are you able to sort of explain to us what supplies have been received to date based on that original letter from the Perinatal Society. So, for example, you've mentioned that there's been sufficient quantity of endotracheal tubes that have been shipped to Sri Lanka from around the world.
Yes.
What about the Vaminolac, intralipids, the ventilator circuits, the blood gas items, and like the cannulas and plasters and things like that? Have you received?
Thank you. I think when it comes to this consumables, we are having a reasonable amount of stock for about 2 weeks of a period, and which are expecting the Indian humanitarian aid load of shipment coming day after tomorrow, Friday morning, and the Indonesian humanitarian aid shipment is also coming tomorrow evening. So within this, we should be able to hold on for another week or two, but that doesn't mean that this ends there. This doesn't, as Dr. Saman Kumara very well said, this doesn't end there, because people are daily, becoming sick. Children are daily becoming sick. You need to focus on them, and we need to, procure things also. In the meantime, we worked out on lateral mechanism, the World Bank, and all these things. It might take time for them to liquidize. So still, we urge, me and Dr. Saman both urge, the donors' contribution to bridge this gap. Donors' contribution to bridge what is faced by the general public is very essential. So, and in the meantime, I would also love to tell you that it is a very narrow window which we are going to face up. But if we really manage it well, and obviously, if we really manage it to the ground itself, like what Dr. Saman was telling, to the person, to the institution, to the people itself, we would obviously overcome this. So again, what I'm telling is, we've got limited amount of stocks, but that has not sufficed our need yet. So still it's open. And I will share the email address. You can drop an email, so you'll get the whole list, which is priority number 1, 2, 3 in the country at the moment. There are 3 lists prepared differently, and which has got the medicines, the pharmaceutical, the surgical items, and the surgical consumables. So it has got all these 3 things. So it will be easy for you guys to understand over that. And, if there's any query, to refer us up, so we will work through.
Thank you, Doctor.
Yes. Can I add something? I totally agree with what Dr. Hamdani said. And what Dr. Hamdani, myself, and other colleges, and all the other medical professional colleges are working on this. There's one bottom line aim for all of us. And we do not want to lose any life because of these shortages. And now, I had a meeting today, massive meeting at Archbishop Hospital. I made a statement, though we are having shortages and we are having so much of response from the international community as well as local community. And all what people say is, doctor, just tell us what you need, and we will give whatever the way, or whatever the possible way, whatever the amount, and please make sure that the people are looked after and you don't lose any life. So when there's a response, when there's a public response to help the health system, and it's our duty, and this is what Dr. Hamdani, myself, and all of us trying to do, make use of this opportunity and get whatever possible items and bridge the gap and make sure that we don't lose any lives on this issue. So that is the bottom line. So we need to do that, because otherwise we will be at fault for not getting the right help from the people, and we will be falling our duty otherwise. Thank you.
Thank you, Dr. Kumara. I think we've got one last question. So one of the questions, one of the attendees would like to know, why can't nitric oxide be produced locally? What is the challenge to set it up within Sri Lanka?
Well, that's a good question. And it's my dream, actually. It's my dream to have nitric oxide locally. But it is a very expensive gas which is produced in only few countries. Actually, it is not even produced in, as far as I am aware, not produced even in India. Even in India, they have industrial nitric oxide. For industrial nitric oxide, they use it for medical purposes, but it is theoretically it's not recommended, because industrial nitric oxide is supposed to be not as clean as medical nitric oxide, but people use it. But we can't use it in a standard system. We can't use industrial nitric oxide. So nitric oxide is produced in some developed countries, and not in all the developed countries, and they import from each other. And what our way forward should be to have the large tanks of, now we are importing individual 20 liter cylinders in a container. But our way forward should be, we should be able to import it in bulk nitric oxide and then fill it to cylinders in Sri Lanka. That is much cheaper than buying individual cylinders. I think I can't think of a situation where we can start producing nitric oxide, but at least in between plan should be, if we can do that, that's a massive achievement. If we can import bulk nitric oxide and then the local company can refill to small cylinders, that will be much, much cheaper.
Great. Well, thank you so much, Dr. Kumara. I think the attendees would really appreciate a copy of your slides. If you could maybe email that to me, I can have it available on our website. And along with the hospital requirements that you were indicating earlier. So I think, does anybody else have any questions? This might be a good time to ask Dr. Kumara whilst he's available. I can see there's one more question, sorry, Dr. Kumara, and you might be able to answer this. There was a request earlier regarding infant formula for Sri Lankan hospitals. Are we able to send it directly from here?
Okay, I think I have to clarify that this is not an infant formula. I think you are referring to breast milk fortifiers. Because infant formula, infant formula is something that we really discourage in our population of newborn babies. We discourage as much as possible. I'm very proud to say, and we have a very massive breastfeeding rate, and almost all the babies are breastfed, and we hardly use formula milk. But when it comes to a situation where we have to use formula milk, we use it. But our priority is formula milk. We never asked for formula milk, but I made a request to, I think, I didn't make a request on couple of my friends. There's something called breast milk fortifiers. I have babies in my ward. People who are in the medical field probably will know. A baby should be delivered around 38, 39 weeks of gestation. But I have babies being delivered at 23 weeks of gestation, 24 weeks of gestation, and their birth weight is about 500 grams, 600 grams. And this baby's growth rate is not as much as we want. And this while being on full mother's milk volume. And this, when the growth rate is not satisfactory, the next step is to give them the breast milk fortifier. This is a kind of a powder form, and which is mixed with mother's own breast milk, and to increase the energy content of the feed. And that will boost the weight gain and the growth of the baby. This is not available in Sri Lanka. And this is not available, and this is, therefore we actually face problems with this small, and this is not a big population, but we have a small population of extremely premature babies, small babies, very small babies, who are fighting for their life, and their growth is really affected. So this is another thing that if we can have it.
Thank you, Dr. Kumara. It's very devastating. So I think everybody will want to do whatever they can to support the newborns in Sri Lanka.
Could I just barge in? I think there is no clarification provided with regard to how to donate to save a dream, or for our project. I don't know whether there was enough clarification made by Harren or you. Probably you or Harren or somebody may need to explain, because there are questions asking, how can we help? How do we donate or something? If you could explain a little bit, very briefly, that would be helpful, I thought.
I'm happy to do that. So we have included that in the chat function, the Save a Dream website details. If you go to the website, there's a Donate Now button. The funds, so when you click on the Donate Now button, you are taken straight to the Rotary Australia page. And as I mentioned before, Rotary Australia is handling all the funds that are donated by Australians. Once we have an established amount, we will be able to purchase the units required for a particular product and send it to the Ministry of Health, courtesy of Dr. Kumara, to Castle Street Hospital, and then for distribution around Sri Lanka as well. If there are any specific questions around those transactions and who's handling them, we would be very happy to answer them. Please put that into the Q&A, chat, or email. Feel free to email us and we'll be able to respond with a very detailed explanation and steps that we have put together. So I think if there are no other questions, there's somebody that's put in a question saying, are we allowed to bring any medical items with our luggage when we come for a holiday?
Sorry,
Dr. Kumara, did you want to take that question? There's somebody that said, are we allowed to bring any medical items with our luggage when we come for a holiday?
Yes, you can. I think it's far better if someone can communicate with us beforehand and get at least get the letter from Perinatal Society, at least from the Perinatal Society, that we have requested this, and as a response to that, you are bringing this to the country. Then otherwise you might get into trouble at the customs or the airport. So people are bringing. I have to say, almost every flight coming to Sri Lanka, there's somebody is coming with a small parcel to do, right? And I can tell you, there was one pediatrician who came from Netherlands, Netherlands pediatrician. She came and she called me, and she came and handed over about 10 endotracheal tubes in a small bag. She said, I heard your voice message. Doctor, I got some ET tubes. I was coming to Sri Lanka, and this is it. And so likewise, every day I'm getting a small parcel, endotracheal tubes, little medical consumables, and people bring it. And I think anybody can bring, but only thing, make sure that you bring what we require.
Can I just ask, I've got my own question about the regulatory approvals, Dr. Kumara. Do you think the NMRA will expedite approvals and things like that so that the shipments can arrive much faster?
Yes. We can get it done to NMRA. NMRA, as Dr. Hamdani said, there are some documents required, because if you are sending it in large quantities, there are some documents which I can share with you on the WhatsApp group. And if you can get those documents, then they will give them NMRA approval.
Okay, great. Thank you so much. Okay, I think that sort of answers all of the questions that we've received so far. There's one more. Is Dr. Kumar has only the neonatal list of hospitals? Yeah, so Dr. Kumara is a neonatologist. And if you are interested in receiving a list of all the hospitals, we can make that information available. But this particular webinar is to understand what the situation is in Sri Lanka pertaining to the newborns and the drug shortages due to the humanitarian crisis. So I hope we have answered all your questions, and I'll hand over to Lionel if you have any final comments before we hand over to Lakshman.
Thank you, Nisha. I think I have a sort of a question to Dr. Saman Kumara. In Australia, as well as I think in most of the countries overseas, there is a fragmentation of Sri Lankan society, along the ethnic, religious, and so on. So there is a question that is asked here, whether the needs of hospitals in the north and east and other areas would be addressed, sort of through these.
That's a good question.
Yeah. Thank you.
Question. And as you know, there's no discrimination, and babies are babies, whether it is what color, what language we talk, what part of the country, from north this into the other end. I'm basically representing whole newborn population, and today I distributed some endotracheal tubes to Jaffna Hospital, and tomorrow some endotracheal tubes are taken to Nuwara Hospital. So I'm in touch with whole country, because I as a person, I can't look at all the requirements in every field, but even the looking after the neonatal aspect as a person is very difficult, but I'm trying my level best to at least to concentrate on the neonatal care. And we are looking after all the parts of the country, every province, and every province is equally treated. I can guarantee, 100% guarantee. And yesterday I sent some, Kilinochi Hospital wanted some equipment. So whatever I get, I distributed for all the needy places. And as somebody pointed out, whether I'm looking at only the neonatal care, yes, right now I'm looking at neonatal care. I'm getting the list from all over the country. I'm getting the list from all the hospitals in terms of neonatal care. But at Castle Street Hospital, I'm basically working for all the requirements, because that's hospital where I work, and I have the capacity to communicate and get the donations. Therefore, I'm basically looking at all the requirements at Castle Street Hospital, because about 3 days back, they ran out of blood glucose strips. They said they don't have blood glucose testing strips. You know what I mean, right? And then I just put up one message, and within 3 days, a monthly supply of glucose strips were given as donation, because it was locally available. And local people, actually all local people, they got together and they contacted me. Only 2 or 3 donors, they got together and donated glucose strips for 1 month supply. And so that's how I look at. But only thing, I don't have the capacity to look at the whole country, and that is the obviously Ministry of Health should do that.
Thank you, Dr. Kumara.
Thank you, Dr. Kumara. Lucky, did you want to take over for closing remarks?
Yes, thank you very much. I think it was a very successful webinar, and it was very informative. And I would first like to thank Dr. Saman Kumara and Dr. Anver Hamdani from Sri Lanka, giving us the picture of the needs of medicines in our country right at the moment. And also, I like to thank you for your leadership, because people like you are really working in the front line, facing the difficulties day to day, and you know what's really going on. And we can only help, and we are glad to help. And thank you for your leadership. We really appreciate that as we all love our mother country. And also, I like to thank all our team, Save a Dream team. Harren Ramachandran is one of the linchpins of the organization. He is the contact for the Rotary and Rotary Club, and his knowledge on logistics and his contacts are really vital for us to carry this project forward. And also, I like to thank the other members of the Save a Dream team, Dr. Lionel Bopage, Dr. Nisha Britton-Jones, Nalika Padmasena, Dr. Damita Dimel, Mahinda Gunawardena, and many others who have been instrumental in getting this project going. And thank you from the bottom of my heart for your efforts over the last few weeks. And also, people who have already contributed to Rotary Club on our request. Thank you very much. We really appreciate that. And we also know that there are many friends collecting funds and doing whatever they can to our country. On behalf of our team, we thank you all. Please continue whatever you are doing. We are doing a very little thing that we have selected to concentrate on neonatal needs of the country right at the moment, but you are looking at other needs of the country. So please continue to do so. We really thank everybody for doing that. And I also like to thank the participants today. Thank you very much on short notice coming and participating in this and asking questions. It shows that what this seminar showed to us was that the need is there. It's going to be there for some time because it's not something that's going to go away quickly. So we have to be at this for a long time. And we also saw the generosity of a lot of people. And what we are doing is we are saving lives. We have to keep that in mind all the time. We are saving lives. It's no little thing. It's a big thing. Whatever the amount we contribute to these funds will be saving lives, as Dr. Kumara mentioned. Finally, I'd like to thank my good friend Mohan. He's the person who wake me up every morning and say, Lucky, we just can't lie down here. Let's be lethargic. The need is high. We should get going and we should rally up, do something. Mohan, thank you very much for your encouragement and your leadership within this Save a Dream team. That's all I have to say. And thanks everybody for participating today. Hopefully we will achieve our dream of collecting at least $100,000 through our project. We have a long way to go, but we are hopeful that more and more of you coming on board after this seminar, recognizing the need to save the lives of little children in our country, you will be supporting us in some time to come. And have a great night. Have a great evening to people in Sri Lanka. Thank you very much.